Okay.
I guess we'll begin then. So thank you so much for coming this evening. Whether you're joining us here live in Ford or virtually, we thank you for coming. My name is Jeff Cruz. I'm one of the current board members for HS, and we thank you for joining us for the evening. So for tonight's events, we will be going over a presentation on wound care, followed by a group discussion. So we'll kind of just jump right in. So for our presentation this evening on wound care, it will be presented by Angie Parks-Miller. Angie is the Clinical Research Manager for Investigator-Initiated Studies here at Angie Ford, and was the President and Founding Director of Hope for HS. So Angie, we'll have you take it away.
Okay, thank you. Again, welcome to everyone that is here tonight, and then also those who are joining us virtually. So we'll have a discussion regarding HS and some wound care strategies, but as we go to the end of the presentation, we'll do some Q&A from those who may be attending virtually, and then those in the audience can ask questions as well. But please just keep in mind that any questions that you ask, we have to limit them to being more broad questions, and we can't give individualized medical advice today. In the context of this conversation today, I am going to discuss some brand name products, but I don't have any conflicts of interest with any of these companies. I'm not receiving any funding for discussing any of these brand names. So the goal tonight, because HS wound care can be complicated, is let's talk about some factors that can influence wound care. We can look at some of the information that we've gotten from some international experts on HS and wound care. We can also look at some of the local HS clinic experience that we've had, and then we can discuss alternatives when insurance coverage is inadequate or it's just not available. So just like all things in HS, it's not a one-size-fits-all situation when it comes to wound care. One of the biggest and most important things in wound care for HS is individualized care. So when we think about wounds and we think about wound care, with HS it's a bit different because we're not talking about a situation where we're expecting the wound care and the dressings to clear or completely cure the situation with the wound. With a burn, for example, we would expect that if we had a burn, we could use certain dressings, we would be able to get it to heal. There may be a scar left, but that would kind of be the end of it. With HS, this is a chronic condition, and so we're looking for things that can manage exudate, which is drainage. We're looking for things that can help protect the healthy and surrounding tissue, things that can help minimize pain, and then prevent infection. And so we know that HS is an inflammatory condition, it's not an infectious process. However, sometimes secondary infections can develop as a result of the drainage that can sit into some of the folds of the skin. So when we look at the wound care recommendations that came out of a Delphi process of international experts. So a Delphi process is basically getting a bunch of people who are experts in a field and asking the same questions and having the same group of people rate the order of importance until an agreement can be decided upon by that expert group. So this expert panel, which included doctors, nurses, from around the world, they looked at a variety of topics, and a couple of the points that I just wanted to plug, because there's actually a number of things they looked at, was 87.5% of them agree that no one cleanser is superior to another. So many patients will find their own individual personal choice of what they like to use as their HS cleanser. Some may like to use Hibiclens, sometimes it's benzoyl peroxide wash, a variety of different things. But at the end of the day, this also continues to drive home the point that HS is very individualized. The other thing is that 91% agreed that not one dressing type was sufficient because your needs may change. So, for example, if you're maybe getting close to the end of your infusion period and you're due for your next infusion, your drainage may be more at that moment, and so your need for the type of dressing you use at that moment in time may be very different than at a different point in time. The other is that there's 100% agreement that cost is a consideration. Cost is very prohibitive for access to some of these wound care supplies. And so that can factor into what choices might be made for individual treatments. Some of the other factors that were brought up is that procedures can affect the type of dressing supplies. So when we're talking about dressings for HS and managing drainage, that's a very different situation than managing post-surgical wounds from HS treatments and therapies. But one of the things I also wanted to point out is that 94.1% of them agreed that system-related factors influence dressing supply choice and access to wound care supplies, support staff costs, and nursing availability. So there's a point that I would like to make with this, and that is that I think it's really important that we kind of share what we're doing at our own HS clinic here in Henry Ford, because what we do in our HS clinic may not be the same exactly that you find in another HS clinic, because access to supplies, access to suppliers will be very different based upon the region that you come from, also based upon insurances. So when we go back to talking about cleansers, and we saw that there was no single agreement over what type of cleanser should be used, and one being superior to the other, we can also kind of look at cost-cutting strategies too. So if you were to look at some of these that are listed here on the slide, HibaCleanse, benzoyl peroxide wash, CLN wash. CLN wash, I would say, is probably at the upper end of cost. And then you could go down to benzoyl peroxide wash, HibaCleanse. But one thing that's actually been recommended, and Dr. Alexa Borg-Kimball published this way back in 2015, was that using something as simple as Head and Shoulders over the counter, very cost-effective measure that some patients may find effective as a cleanser in managing their HS. When it comes to dressing types, there are a lot. There are hydrocolloids, there's alginates, they all have fancy names, they may have fancy brand names, but at the end of the day, we need to focus on what is going on with your HS activity at the moment to know what types of dressings to choose to use. So if we're looking for a situation where there's a moderate to heavy drainage that's going on, I want to kind of focus in on those items. Because those tend to be the time periods where you're having breakthrough drainage that's leaking through clothing, and let's see what we can do to help manage some of that. So in managing drainage and odor, you want to look for potentially things like silver alginates. Now, if you have a silver allergy that's using something that has silver incorporated into it would not be an option for you. However, you can have alginates or hydrofibers that do not contain silver. So alginates are great because they are very absorbent. They can conform to the shape of a wound. They can be tucked very easily between skin folds. They may need a secondary dressing, something that covers over the top of it if it's getting very full of drainage and so that it's not leaking onto clothing. But it can actually help to manage the drainage so that it's not doing additional trauma to the skin around it that doesn't have HS. And so the difference between these two that you see, the silver alginate that's on the top, that silver cell, versus that aqua cell that's on the bottom, is that alginates, as they hit moisture, they will expand laterally. And hydrofibers, on the other hand, they will expand vertically. And why that can be important is that if you're trying to keep the rest of the surrounding skin protected and keep it from getting exposed to additional drainage that could irritate it, you would want it to be expanding upward versus outward. So that's one product that could be very helpful. But we've been recommending that to patients to use to control some very moderate to heavy drainage. In addition, foams are a really nice product too. They are also for moderate to heavy drainage. You can get them with or without borders. You can get them with or without silver. They're really good for cushioning and protecting an area, especially high friction areas. The challenge with it though is insurance will only cover those to be used 3 times per week per location. So if you're having a lot of drainage, it's great to catch that drainage, but if you need to change it more than once a day, the insurance isn't going to cover the balance on it. So it's something to keep in mind when you're using those types of products. Now, these are also expensive. Hopefully you can get insurance to cover it for you. If you can't, as an alternative, you can look for silicone bordered foams that are available on Amazon, for example. You can see in this slide that there's actually a variety of sizes. This one, for example, that's listed on here that says with wings has these relief cuts in it, which can be useful if you're trying to put them in the armpit, for example, because they can conform to the shape of the arm and the fold of the arm more naturally. One of my personal favorite dressings that I like, and again, I do not have any conflict of interest in this company, is I do like something called super absorbent polymers. And I like them because they can hold a lot of drainage, but they can come with a silicone border so that you are not going to have a lot of trauma to the surrounding skin. It can be really irritating, as I'm sure everyone with HS knows, to have to be using tape all the time, and having the tape actually sometimes doing some damage to your skin as well. So these silicone bordered products tend to be less traumatic to the skin, while using these super absorbent polymers really helps to draw that drainage away so that you're not getting additional breakdown of the skin from the drainage itself. And the great thing about it is that these are able to be covered on a daily basis by insurance versus using the silicone bordered foams. Now, if you are not able to get that covered through insurance as an alternative, this is another option through Amazon. Again, this comes in a variety of sizes. There's a variety of different names. It's not just this Everlit product, but there's a variety of them that you can choose from. Now, one thing that's very important to support getting insurance coverage, however, is documentation. And this is something that in our HS clinic, myself and our wonderful residents have worked together on to make sure that we have the documentation that's necessary to support it. So any licensed medical provider can write for a wound care supply. So if you have a hard time getting into your dermatologist, it doesn't just have to be your dermatologist who writes for those supplies. MD, DOs, PAs, NPs, they can order and write for those supplies. But keep in mind that they're usually covered in 30-day increments, and so that means additional documentation might be required, which might mean an in-person visit again. So because all of these things that you can see on the screen here, the measurements of the area, the amount of drainage that you have, all of those by insurance are required to be updated about every 30 days. So, but in making sure that you have all these things there, we've had some really great success in very recent success of making sure as many patients as possible have been able to get dressing supplies covered for them. And then another thing that can be considered as far as wound care is Hydraware. So Hydraware is a company that was created by a patient with HS, and they created both tops and crop tops and some briefs that can be used. These dressings don't actually adhere to the skin, they adhere via a piece of clothing. It may not be the most ideal situation to use after having an excisional or a surgical procedure, but it is something that might be great for your day-to-day maintenance when you have your HS drainage. But overall, there are some really great options to help manage some of the drainage for HS. And if anybody has any questions, I'm happy to help answer them.
We're live on Facebook.
I'm sorry?
Can you tell them like if they have any?
Yeah, if there's anybody in the Facebook group that has any questions, please feel free to ask. Again, just please keep in mind that we can't give individual medical advice.
Angie, that was fantastic. Could you explain the difference again between the silver alginate and the gel?
Sure.
How does it make sense that one expands laterally versus vertically? Don't they all expand like three-dimensionally?
So it has more so to do with, so one is comprised more of like it's the seaweed, and the other is more strictly different types of cellulose fibers. And so the traditional alginate will expand more, it's actually a thinner product if you look at it. It will expand more laterally. It holds about 15 to 20 times its weight versus the hydrofibers, which have that vertical volume ability, and they will hold up to 30 times their volume, or their weight.
Makes sense, thank you.
Mm-hmm.
Do any of these have any specific antimicrobial properties?
So both, with the silvers, yes. So you can, if you have, and we've had a few people who have sensitivities or allergies to silver-based products, and so silver is not an option for them, but silver can be really great for helping to control odor. Patients who use it should be aware of the fact, though, that it can change the color of your drainage. So it can change the color to be even more of a green hue, I've seen. But it's not because an infectious process is going on, it's just the silver ions and the way they interact with the drainage changes the color.
Do you have any recommendations for, I guess, like tape that can be used?
So silicone tape, for some, have found that to be helpful as an alternative to using, micropore. Hypofix, I know, has been recommended by a number of people. The thing with tape, though, that I would say to keep in mind when you can do it is making sure that rather than trying to tape off an entire area, if you're able to do so, try and use your tape as anchor points and try to rotate them so you're not consistently hitting the same location and trying to avoid, try to give the area a little bit to breathe and relax and recover from the tape that it was just exposed to.
We don't have any questions in the chat.
Okay.
I have a question. Thank you so much for this presentation. I was wondering, in terms of how frequently the dressing needs to be changed, does it differ based off of the type of dressing, or are they much standard across the board?
So if we're not talking in the setting of post-surgical treatment for HS, if we're talking day-to-day routine, it's really going to be driven by the amount of drainage that someone has, and also personal preference. So I would say at least daily those are going to be changed, but if someone prefers, for example, to use a foam-based dressing, which is only covered 3 times per week to be used per location, and that's because they prefer to shower every other day, then that might work for them. But if someone wants to be able to shower and change their dressings daily, then something that would be covered on a daily basis would be the more optimal choice.
That's really good information.
You're welcome. One other thing that I wanted to add, and I thought about it after I put my slides together, was there are some over-the-counter wound care sprays that some have reported having some success with in helping control pain. Like if you're having pain with dressing changes, there's some products over the counter, and maybe we can post it in the chat at some point. We'll put the link in there. Not that we're endorsing any particular product, but these are products that are designed for dressing changes, wound pain, and that are hydrogels, so they are more soothing to a wound, and they also contain a very low percentage of lidocaine.
And if a person has more of a dry wound versus like a weeping wound or one that's draining, like is Vaseline okay to use with that, or is there any other topical? Because I know like sometimes with dressing, when it rubs against the open wound,
Yeah.
it really hurts.
Yeah, so if you're really trying to, if you're not draining that much, but you want to have some protection because maybe you drain if you move a certain way, then yeah, using Vaseline is fine. The other thing that is over the counter that is inexpensive is Desitin. Desitin, which is made with zinc oxide, and you only need a little bit, goes a long way with that, is just using a very small amount to put over the top of the skin. It'll help create a barrier too if you do have any drainage or moisture to help protect the skin. Then also should assist in making sure that that dressing doesn't come off or doesn't adhere too much when you're trying to do your next change or create too much friction. And then another thing too is if you do find that maybe your dressings are sticking, some have reported really finding better success with changing those dressings in the shower, but definitely getting them wet will help to, make them come away from the skin easier rather than pulling.
What about like skin prep for a dressing change or adhesive remover versus necessarily getting in the shower?
Yeah, you could do that. Not everybody has had access to that, and so that could be sometimes a challenge for some. I've actually had some patients who have gotten a little irritated from that too, doing some of the preps. So again, at the end of the day, whatever you find individually that works best for you, if you prefer to do it in the shower, if you prefer to use Vaseline, you prefer to use zinc oxide paste, you prefer to use the preps, whichever it is that you find works best for you and fits into your routine the best.
What cleanser do you recommend after a surgery or a de-roofing procedure? Just like a mild soap or antibacterial soap or whatever they've been using before, like HipaCleanse?
Yeah, if they've been using, for the most part, if it's de-roofing, my personal preference is not necessarily to use HipaCleanse because we want that to close up. We don't want to disturb, the normal process of wound healing, which includes some inflammation, includes those, certain proteins and growth factors that we don't want to have disrupted by things that can be more antibacterial based. With surgical excision of HS with CO2 surgery, again, same kind of thought. We have been recommending to just use a mild cleanser after surgery versus using something that's more antibacterial.
Okay, so, but like HipaCleanse would be good for like everyday, just regular HS wounds, but not for surgical wounds.
So I'm not going to say a blanket statement. I'm just saying for us at our HS clinic for CO2 surgeries, after someone has a CO2 surgery or after someone has a de-roofing procedure, we do not automatically tell them that they need to use HipaCleanse or any other sort of an antibacterial-based wash.
Okay.
We're recommending gentle washes. There can be individual circumstances where those recommendations will change.
Okay.
So when you say a gentle wash, you mean like a plain old ivory or a plain?
So Dove, Cetaphil, CeraVe washes, those are very gentle.
There are no questions in the chat. So I guess if you want to do that again.
All right. Well, thank you.
That's